This is Dr. Lindsay Remy. I want to give you some practical tips and what to expect in the final days before your knee replacement surgery and on the day of. First of all, you will have a nurse preoperative visit about a week ahead of time. This is really our best chance to run through a checklist and make sure everything has been done. My nurse will ask you questions about your help after surgery. He or she will verify your medications, your allergies, the pharmacy that you plan to use, the physical therapy location you plan to use, and we'll make sure everything is up to date before your surgery. I will say that this is your best chance to finalize that physical therapy location and pharmacy information. It is very hard on our staff if you change that information at the last minute. You will also be getting a CT scan for the Mako robotic technology to use, as I talked about in the prior video. Usually that is done between 2 and 4 weeks before surgery. So you may have had it before this nurse pre-op visit, or it may be scheduled right afterwards, depending on the timing. You will also be hearing from a company called Kinex. We use them as a third-party vendor to help make sure you have all of the equipment you need before surgery. Most of that equipment is paid for by your insurance company. They will talk to you about what your expected copay is. Please know that you are welcome to get your equipment elsewhere if you want to, if you already have it. There is no pressure from me to purchase through them. We do this purely for your convenience, to have one place to get the things that you need to make yourself as safe as possible after surgery. The things that I recommend everybody has include a walker, a 3-in-1 bedside commode, a shower chair, and a polar pack or an ice machine. The ice machine is not covered by insurance, and there is a cash cost to that. It does help a lot with pain control though. By pumping cold water into a pad that goes very close to your skin, it keeps the swelling down, so I highly encourage it, although I realize not everybody can afford to get it. And then you can use regular ice packs or frozen vegetables around your knee to try to get the same type of effect. If you're using that, you just have to change them out as frequently as possible to keep your knee cold, and that helps minimize the swelling after surgery. If you're using Kinex, you will expect a call from them about 2 weeks ahead of your surgery, and they verify the desire for specific equipment, and they verify your insurance information, and then you typically receive a second phone call to schedule the delivery of your products about a week before. Sometimes it's not until the last minute that they call you, but you should be getting that second phone call, and they typically deliver the equipment the day before surgery. If you're having any problems working with Kinex, or you have not heard from them in the time that you expect to hear from them, please reach out to Mary Grace, my surgery scheduler, and she will try to sort that out so that we can finalize the equipment that you need. The day before surgery, you should hear from either the surgery center or the hospital where you're having surgery to tell you the arrival time. Your arrival time is typically between 1.5 hours and 2 hours before your scheduled surgery time. Please know that we do everything we can to make our surgery schedules as realistic as possible so that you're not spending too much time waiting. But surgery is an unpredictable process, and sometimes the cases before you may have taken longer than expected, and you may be waiting. So if you need to bring a book or a laptop to make the time go by faster, please know that you're welcome to do that. On the day of surgery, you will meet several important team members. You'll meet the anesthesiologist and the nurse anesthetist, who will be in charge of keeping you comfortable while I perform the surgery. You'll meet nursing staff that will take care of you before and after surgery, as well as the nurse that will be in the room with me. I encourage you to talk to the anesthesiologist about any questions that you might have about anesthesia, the risks of it, or any of the specific choices that he or she recommends for you. Of course, they will talk you through the process automatically, but if you have specific questions, please bring them up with the anesthesiologist on the morning of surgery. Once you're ready for surgery, you will be rolled back into the operating room. You will have gotten some relaxing medicine before this point, so you may or may not remember meeting all of my operating room staff, but we do typically introduce you to everyone when we get back there. And then you will get your spinal anesthetic, and then you'll be laid down to be positioned, at which point you are very much not aware of what's happening anymore. And the rest of the process is typically a blur while I safely perform your knee replacement surgery. Then you're awoken and you roll to the recovery. This is the point that you're typically become aware again, and we make sure your pain is under good control. You stay in the recovery area until you're awake enough to eat, drink, and walk. We need you to walk to the bathroom before you can safely go home. That's with a walker and with assistance, of course, but we need to see that you can safely get around so that we know that you're safe for discharge. Most patients go home the same day of surgery, which is why most of my knee replacements are done at an outpatient surgery center. For some people, that won't be appropriate and they will need to stay overnight in a hospital setting. If you have concerns about going home the day of your surgery, please speak to me about that ahead of time so we can make sure your surgery is scheduled appropriately. We do have you work with our nurses at the surgery center to make sure that you're safe on your walker and that you're getting around adequately in order to go home. But being home after a knee replacement takes some thought and planning, and I'd really like to make sure you've done that now ahead of time. For instance, you need to make sure you know who's going to be helping you get around. Is someone there strong enough to help you up if, for example, you were to fall? How are you going to get from the bathroom to your bed? Do you have a clear path? Is there space for your walker? These are things that I need you to plan out ahead of time so that your recovery can be as safe and smooth as possible. After you've successfully walked to the bathroom, the nurses will go over your final instructions and get you dressed to go home. All of your instructions are going to be written down. There will be a packet that has multiple pages of written out instructions. Everything is very clear, but please, please, please read the handouts that I give you. I have written down for you when your surgical dressing comes off, when your follow-up appointment is, even how often I want you to ice your knee. So I encourage you to please read that information very carefully. You're going to get dressed, and this is one tip I have. Please make sure you have loose clothes that can go easily on to make that process easier. And then they'll wheel you out to your car and you will be on your way home.